Colorectal cancer screening, UDS requirements, and how to meet them. What UDS requires: patients ages 50 to 75 who've had at least one medical visit in measure year, which is January 1st to December 31st, have the appropriate screening for colorectal cancer. And these are a colonoscopy during the measure period or the previous 9 years, a flexible sigmoid scope during the measure period or the 4 years prior, or a fecal immunochemical test or FIT test during the current measure year. Who's excluded from this report? Patients 50 to 75 who have a diagnosis of colorectal cancer or colonectomy. The UDS report will look for the following ICD codes in the problem list or in the assessment section of the patient's progress note. So these are the codes. If they find, it will exclude them from the report. Let me sort of point out that this bottom one, the Z85, is going to be, it's a very general code, and it's going to be probably the easiest one to use because it just says they had cancer in the large intestine, and it's not specific. It'll cover everything, and it'll exclude your patient from the report. How to get credit for a colonoscopy? The results must be correctly attached to the appropriate DI order. And here's an example here. We have a DI order for colonoscopy. It shows the date that it was done. It's been marked received. And for bonus points, here in the results section, it was recorded what the result was and when they need to repeat that test. Just a reminder, results that have been filed in patient docs and not correctly attached to a DI order will not count. Our audit program cannot find a colonoscopy that's been dumped in patient docs. So if you get a colonoscopy result sent to your DI, sent to your D-Jelly Bean, you need to send it to someone to have it attached to an order. In-house testing or FIT testing must be done once per measure unless the patient is current on their colonoscopy. When the patient returns their sample for testing, just remember results need to be entered into ECW correctly in order for you to get credit. And a lot of clinics tend to focus on doing the FIT testing with physicals, but remember our requirement are they have to have colorectal screening for doing FIT testing once per measure. And just an example how relying on physicals is not always a good way to do this. If a patient comes in and has their FIT done with their physical in December 2016, they came in March for follow-up. They had a sick visit in September. At none of these visits did we try to do another FIT test for this current measure, and they didn't do their physical until January of 2018. So even though their FIT tests are 13 months apart, we're not getting credit for 2017 because in the actual current measure, it was not done. So don't rely on your physicals to get this done. Officially has to be done per measure.